Marvin Goldfried is a distinguished professor of psychology at Stony Brook University, where he helped to develop the graduate program in clinical psychology. He's the co-founder of the Society for the Exploration of Psychotherapy Integration. Alan Francis is a professor of psychiatry and chair emeritus at Duke, and was chair of the DSM-IV task force. Marvin describes the evolution of his psychotherapy orientation as psychodynamic, behavioral, CBT, and eventually integrative. He practices, teaches, and supervises what works clinically using direct and indirect evidence base. Alan describes his approach to psychotherapy as whatever works, or no one size fits all. He was trained and taught at the Columbia University Psychoanalytic Center, but remains equally interested in brief, supportive, cognitive, behavioral, interpersonal, and family therapies. Please enjoy this week's episode.
Good morning and welcome to Talking Therapy. I'm Marvin Goldfried here with my long-term friend and colleague, Alan Francis. Good morning, Alan.
Hey, Marvin. Good to see you.
Yeah. So listen, in the last couple of podcasts, you and I have been talking about whether you always need to focus on the future or the past in order to bring about change. And I'd like to broaden that topic a bit. Namely, how can a therapist's knowledge of time frame help with the therapy focus? Let me say a little bit more. When I first explained that to you and you said, I don't know what the hell you're talking about, I think, well, there's something wrong with Alan. And then I described it to another colleague who said, I don't know what the hell you're talking about. So perhaps it's me. I mean, I have this feeling that I know what I'm talking about, so other people should know as well. I don't know what Piaget would say about that, but it's often wrong. So let me explain. Okay. One of the things that seems evident is that time frame focus sometimes is a function of or often is a function of one's theoretical approach. So, for example, CBT focuses a lot on homework. What do you do after the session? So that's an immediate future time frame, and says this is going to bring about change. Experiential therapy, whether it's Rogerian or Gestalt, focuses on what's going on in the session. So the time frame is within the session. So traditionally, time frame has been a function of orientation rather than what's appropriate for the therapist to make use of with any given patient at any given time.
Well, like the psychodynamic person would be saying, I focus both on the past to look for recurring patterns in the patient's life that are recreated in the present. And the immediate present would be the transference in the room,
right,
that we are able to recreate the past in the current moment. And by understanding the current moment, we're able to change the past through corrective emotional experience.
Yes.
That's the kind of thinking you're talking about.
That's right. And again, it's an indication that the therapy focus on the time frame in the patient's life is a function of orientation rather than what might be appropriate at any given time.
And so focus on the future would be more part of sort of rehabilitative models that say, we know that you're here now, but we take one step at a time into the future, and with a different attitude toward the future, one that's filled with more hope and planning, that will improve your present.
Right. Exactly.
So you're saying that different models tend to focus on, have different relationships to past, present, and future, and that sometimes that's appropriate for the patient and sometimes it's not.
Right. So the question is, when is it appropriate to focus on different time frames? And in our
Marvin, by the way, I like this a lot. So now that you've explained it, I get it. I'm constantly learning from you.
Oh, thank you. Yeah. Well, I appreciate that that now you understand, and I see it as a function of my idiosyncratic, if not autistic, thinking and
I like to think of it another way, that in Plato's dialogues,
yeah.
there's Socrates, that's you, and then there's a guy called Simplicius, that's me. And my simple-mindedness forces Socrates come to elaborate wisdom.
Well, yeah, I do not think you're by any stretch of the imagination simple-minded.
Well, we'll see. But go ahead. How are you going to apply this?
So I think it'd be useful for us to look at these different time frames, which I was saying we actually coded when we compared different approaches to therapy in our process research. And we found that, true to the orientation, the time frame tended to be more frequent with one orientation versus another. So so here's what we coded for. So we can talk about different time frames and what their function might be. You got the distant past, okay? That's the early history. And then we also coded for recent past, like within the past few months. Then we coded for in-session focus. Then we coded for near future, like in the next week or so, and then distant future. So what's the function of each of these that could be used by therapists of any orientation?
The more I hear it, the more I love it.
Okay, so answer the question. Distant future, why focus on distant future? Why should an experiential therapist or CBT therapist focus on, let's say, distant past?
You want to start out with distant past?
Yeah, and we'll work our way up to the future.
What I'm most interested in is actually future, because I think that's the part most ignored. But distant past, I think, is essential to psychodynamic understanding. And as we discussed last week, I think should be essential to every therapist understanding, because people repeat the same patterns over and over again. And when they understand, it's been so vivid to me in my practice over the many years, when people understand that what they're doing now is not something that's fresh, but rather a pattern of behavior they've had over and over again, it gives them a sense of freedom that they can do something about it that previously they didn't have. People who are trapped in the present often don't have the insight that they're contributing to what's happening, and that by understanding the repetitive patterns that they get into that cause them trouble, they can change them.
Yeah.
It's a key. It's a kind of key to freedom, that you don't have to repeat the past once you understand it.
So it's not only the patient becoming aware, but also the therapist becoming aware, so that they can point to something as being, oh, here you go again, but not
Exactly
in that,
exactly
in those words. And I think that's important. And I think that CBT therapists sometimes don't pay attention to the notion of patterns. I think we have a history where we believe that behavior is specific to a specific situation.
I think CBT evolved, and with the discussion of schemas,
yes,
especially Jeff Young's work, people began to realize that just focusing on the present was losing a tremendous opportunity
right.
to understand it in context.
Yeah. And there's also other stuff too that CBT is not very much aware of, and I don't know about psychodynamic, but experiential therapists, and particularly process experiential like Les Greenberg and others, sometimes there's what, quote, unfinished business with people in the past, significant others, and that it's messing up the future. And I think psychodynamic therapists recognize that. They talk about parents all the time, and it was because of your parents that you're this way. But isn't it the case within psychodynamic therapy that hopefully there comes a time when the person gets to see why the parent has behaved in that way, and maybe forgives them? And
yeah, we talk about the pluses of focusing on the past, but there's also considerable negative.
Yeah,
if the therapy gets bogged down in the past, it can be a preventive from changing in the present. You can hide in the past, which helps prevent you from changing in the present, protects you from new experiences in the present. Plus, it can lead to a blame game. Oh, the reason I'm having all these problems today, look what my parents did to me, look at my unhappy childhood and all that stuff. To the degree that the past overwhelms the present and becomes an excuse for not changing in the present,
Right.
I guess with anything, if you focus too much on any one thing, it becomes more of a problem than a solution. And I think that the problem for psychodynamic therapists is a tendency to focus way too much on the past at the expense of the present and the future.
Right. So I think the therapist, regardless of orientation, is why am I focusing on the past now?
Yep.
Rather than just knee work.
And it has to be, I'm focusing on the past now because it sheds light on this moment.
Because I need to get information, or because they need to resolve and maybe reevaluate why their parents behaved with them in a certain way.
And then it pertains poignantly to what's going on this minute in the transference in the session, which is experiential, and to the problems and behaviors the person has outside the session, the relationships that they form over and over again, and the problems in those relationships. The past is only really important in therapy if it's directed to understanding the present and changing the future.
Yeah. Who is it who said that the past doesn't exist? It's in the present. It's not the past.
William Faulkner.
Oh, there you go. Not so naive, are you?
Not so naive.
Anyway, so that's one. Then you have the recent past. And that's very, very important, I think. Because it deals with ongoing stressors that the patient may be confronted with. And there's an awful lot that's been written about this now. Dealing with bias and discrimination and intersectionality, and how certain people get discriminated against, whether it's overt or whether it's covert, and that how this affects the person and their symptomatology. And I think it's important to recognize that because it's too many people fall into the trap of saying, oh, well, this person is depressed and they have this diagnosis, so we need to deal with the depression, when you may need to deal with the environment. The person needs to get better medical care. The person needs to be treated more respectfully and more responsively, because if they don't, they may get frustrated and feel depressed. So to apply a therapy for depression when it's a function of what's going on in the person's relatively current situation, recent past, I think just overlooks the reality.
Yeah, I think that the most important question in any first session, and actually one of the most important questions for every session that's ignored and not asked, is why now?
Yes.
What's happening this moment to have these particular reactions, these particular symptoms, that people don't come to you at a random moment in their life. There's usually there may be long-standing problems, but there's usually some acute issue. And the why now question is the one most likely to get at it.
Because that may determine the kind of intervention that's needed. Yes?
Yep.
Where does that issue fit in all these clinical trials that have been done over the past several decades?
Say it again?
Is this an issue that is dealt with in clinical has been dealt with in clinical trials over the past few decades?
The why now?
Yeah.
Yeah. No, I think that people are treated too generically in studies. It's very hard to be particular enough to try to do a research question that's going to focus on the specific, my boss said this to me yesterday, kind of idiographic data.
Yeah. It's a harder research question, but without it, you're barking up the wrong tree.
Yeah. And clinically, again, if people come away from our discussion this morning with nothing else, I think the most important thing we could say is why now?
Yep.
And suggest that this be much more a part of their inquiry about the patient's life and about the circumstances that are responsible for this visit. Why every first visit?
Yep.
Why are you coming now? What's happening now that's different? And really something that follows through session after session, because whatever the patient's feeling in each session will probably have a why now attached to it.
I like that. I also like your other question that you said we should be asking ourselves, and that is, it depends. It's not a question, it's a comment. It depends. What should we do? It's a response to a question. It depends.
Right.
It depends says we need to know about moderator variables as clinicians. And hey, researchers out there, we need more research on moderator variables. And the why now is a very important clinical question, but it's not a question that therapy researchers have been asking enough. So I think the focus of our research should pay attention to some of these key clinical questions. Otherwise, why do the research? And we're not going to get into the answer to that question of why do the research, because there are lots of other reasons that have nothing at all to do with clinical application. Okay, so we got distant past, we have recent past, we have in session. And this, of course, is, as we've spoken about, I think the biggest drawback in many CBT therapists. In session, I see it as being very, very important and, in fact, very consistent with behavior therapy. In session gives you a sample, potentially, of a person's behavior. So if the person in session is very hesitant, and doesn't make eye contact, and their facial expression is of a certain way, that's very important information, which may be specific to the therapy situation, but it also may be a sample. So that's one use.
I think the problem here for cognitive therapists is sometimes they get, especially the ones who have been trained to follow manuals very closely, they're so intent on doing what the manual would say that they miss what's particular and personal and individual about each patient. And the way they apply the manual will be generic rather than poignantly related to that person's mannerisms, the way they speak, the emotion they feel in the room, and also your reactions to them.
Yeah. I would argue, and I have in the past, that for a CBT therapist to not pay attention to what's going on in session is they're doing bad CBT, because they're not talking about, particularly if they're talking about behavior and emotion, and they're asking, well, what went on last week and what are you going to do next week? They're not talking about behavior. They're talking about thoughts or plans or recollections. The behavior is what is within the session. And to intervene, you can do an in vivo intervention, which I think is much better than a homework assignment, if you can do an intervention in vivo, because the problem, if it's occurring right within the session and you can change it, that provides much more of a powerful corrective experience for the CBT patient.
I've said it before, but it bears repeating because most people may not have heard all of our previous sessions. But the Becks, who are the sort of fountain of cognitive behavior therapy, are two, Aaron Beck, the father, Judy Beck, the daughter, are two of the most empathic, with it people I've ever met. They don't train people in manuals. So anyone who's learning CBT through a manual is not learning it the way they meant it, CBT to be done. They were very alert, among all the human beings I've ever met, amongst the most alert to how people are feeling in the moment, and alert to figuring out a way of establishing a firm relationship in the session and using the patient's responses in the session to further the treatment.
Oh, that's another one of your sayings that we should frame and put up on the wall behind the patient. Follow the patient.
Not the manual.
not the manual.
Not the manual, not the supervisor. Follow the patient.
Well, it depends on the supervisor.
But we don't have that much time. Let's get to the future.
Let's get to the near future. I know you're trying to get to the distant,
Right.
to the near future. The near future is, and you could question it more generally. Well, how? Well, it wouldn't be the near future. It would still be the recent past. But the near future essentially is, the way I put it with patients is, what's the take-home message from today's session? I don't use the dreaded H word, the homework work. What's the take-home message that you could apply? What could you do differently in your work habits? What could you do differently in your study? Or what could you do differently in your relationship with your significant other?
I think that's great. I don't think people change in the past. I don't think they even change that much in the sessions. I think most of what helps people change is in the near future.
Yes.
It's how they use what they get in the session to change their lives outside the session. And that's always the near future. They don't change in the distant future. The change happens in the near future. And I think that therapists have not focused enough on that.
Let me ask you a question, Alan. I'm not quite sure what the label is nowadays. You could call it, interpersonal psychodynamic. You can call it relational psychoanalysis. I don't. But it's basically dealing with the relationship. I guess it's more of like a Sullivanian approach more generally. And do they deal with homework or suggestions that people do things differently?
I think there's a lot of controversy in the field, and I think if there's a problem with psychoanalytic work, it's the biggest problem, I think, is focusing too much on the past to the exclusion of the present. The second biggest problem is being happy enough with changes in the sessions. We're having great sessions together, and it feels like that's good enough. I think for a psychodynamic treatment to be meaningful, it has to have much more focus, as you're putting it, in the near future. The question should always be after a wonderful insight in the session, okay, how are you going to use this outside? It shouldn't be, we're delighted together of having this wonderful relationship and having these wonderful insights. Some of the patients who've changed least in my practice over the years have had the most wonderful sessions, but it didn't impact in their near future.
Yeah.
So I think it's very important. And one of the things I used to teach very hopefully successfully, you're never happy understanding the past, just understanding the past. You're never happy just having great sessions in the present. You're always focusing the patient. Well, how does this change your life? What are you going to do differently?
Yeah.
How can you make this next week somehow different from the previous weeks in the entirety of your life? I think focusing on the near future is a key to every form of therapy.
I'm thinking of a question might or might not merit being posted on your wall. Person comes back after you've said, how are you going to make use of this? Or what's your take-home message? And then you have the following week, they come in and you ask the question, how is last week different from other weeks?
I like it. There's a great scene in the movie High Anxiety, Mel Brooks movie, very funny movie, High Anxiety, which Mel Brooks has an insight about why he has an anxiety about heights that goes back to his parents fighting around his high chair and him being knocked over. And he happens to have this insight while he's falling. He's on a high level of a tower. He's just holding on by his fingertips to be able to survive. And he calls down to his old professor, his psychoanalyst, and says, "What do I do now, professor? Now that I've had the insight, what do I do now?" And the old professor says, "Climb, you son of a bitch, climb." I would sometimes give that. Patients often ask, "What do I do now?" You have a terrific session. What do I do now? And I tell that story, climb, you son of a bitch, climb, which means make a change in your near future.
Right.
Don't
Well,
just be so happy with the insight that you're satisfied that that's enough. Having the insight's not enough. You have to go out and make a change. Climb, you son of a bitch, climb.
that's the copper that is used to produce the alloy together with the gold of analysis, according to Freud. The copper of suggestion.
I like it.
I like that. Okay. Now's your big chance. Future.
I actually have a lot of experience with this because like I get a lot of phone calls asking me to speak to people who are very demoralized.
Uh-huh.
I'm not doing regular practice now, but people call me and say, I have this friend or I have this relative or I have this patient and I'm at my wit's end and nothing's worked. None of the medicines have worked. None of the psychotherapies have worked. The person is completely demoralized. And I think for me, the focus there can't be on what's happened in the past because that's been a disaster. None of the treatments have worked. This is someone who hasn't gotten better with lots of treatment. And I think the focus there has to be on the near future and on the distant future. The near future, usually my advice is simple things like exercise, figuring out good minutes in each day. How can you make your life different minute by minute in the next week? But it also encompasses the long-term future. That because things have turned out badly in the past doesn't mean that they'll turn out badly in the future. That you can't extrapolate the fact that things haven't worked so far for you in your life and in your treatment to be absolutely sure that it's not going to work in the future. The time does heal, that getting into a different stage of your life can be very important in changing things, and that you can do subsequent things now. So you can do things now that will subsequently have a big impact on the long-term future. Little things that improve now can result in much bigger changes with positive feedback, amplification in the future. Reversing a vicious cycle now can lead to a virtuous cycle that will change your future in ways you can't even imagine at this point. I tell them I've seen, hundreds of people, thousands of people in just your state now, and just your fix, feel a very big change in the long term. And you can't despair just because things are terrible now and have been terrible for you. Trying to instill hope for the hopeless. But it has to be realistic hope. You can't say, oh, things are going to be fine. You have to find ways of finding islands of health and islands of possible recovery in what seems to be a vast ocean of despair.
That's so eloquent. Really, seriously.
Yeah.
And I particularly like hope for the hopeless.
Yeah.
Well, that's a good note or tone on which to end. This is good. And
Yeah, and this is really interesting. I started out being very skeptical that anything in this area could be that interesting, but it turns out that it's the most interesting. So I'm really,
okay.
Thank you, Marvin.
Well, we'll put our heads together and figure out what we're going to talk about in the next podcast.
Okay, see you, Marv.
Take care of yourself. Bye-bye.